In the previous video, we already looked at the question of what effects cancer therapy can have on future fertility. And you now know that treatment can sometimes make it more difficult to have children of your own later on. Because some cancer therapies, like for instance certain chemotherapies or even radiation therapy, can damage the oocytes or eggs in a girl's ovaries. It is important to know that all eggs are present in the ovaries from birth, where they then will normally mature gradually starting at puberty. This means that no new eggs are added, and eggs that are damaged by the therapy cannot be replaced. But there are various methods to preserve fertility as best as possible. And these are exactly the methods we want to introduce to you in this video. And at the same time, we'll also talk about the possibilities and limitations of these methods. In this context, by the way, we also speak of fertility protection or ferti-protection, which means protecting fertility. But first things first. And this is very important. Whether such protection is necessary and even possible must always be clarified and decided individually. With cancer, treatment sometimes has to happen very quickly. This means, unfortunately, that sometimes there simply isn't enough time to take additional steps beforehand to preserve future fertility. In addition, one has to consider that some of these procedures involve a surgical intervention, and that of course means an extra burden on top of everything else. And last but not least, the options available also depend on the girl's age. That's why the doctors will always look very closely at whether such a measure is really an option or not. And it's also important to note that while these measures can increase the chances of having children later, there is unfortunately no absolute guarantee. So getting individual advice and information is important. Your doctor can discuss this with you and also consult other specialists who are familiar with the subject. We've also linked a list of contact points below this video where you can find help and information. And not all the procedures we present here are covered by statutory health insurance. So it's also good to clarify this in advance to be on the safe side. Okay, so now that we've cleared all that up, let's move on to the specific methods that can help to preserve fertility. One possibility for girls is the use of so-called GnRH agonists. These are medications that affect the release of a specific hormone in the brain. The idea is that they ensure that the ovaries are put into a kind of sleep mode while the chemo is running. The hope is that this way, the ovaries will be better protected and can resume their function later again once the treatment is over. This method is therefore only an option after puberty. However, a certain loss of egg cells cannot be prevented even with this. Again, the overall benefit depends on the planned cancer therapy. So this means that there is no guarantee of future fertility, but the advantage of this method is that no valuable time is lost. Ideally, you should start before therapy, but if necessary, you can also start during cancer treatment. And you can also combine GnRH agonists with other procedures that also serve to preserve fertility. Something else you should know is that a typical side effect of GnRH agonists is that menstruation stops because the hormone suppresses the normal function of the ovaries. And there may also be other hormone-related side effects similar to those in menopause, such as hot flashes. But don't worry, this usually passes once you stop the medication and is also quite rare in young girls. Another method to preserve fertility is the freezing of egg cells. This is also known as cryopreservation. In this process, egg cells are removed before cancer therapy and frozen for later. However, this is only possible if the body is already producing mature eggs, meaning after the first period. And since vaginal ultrasound checks are also necessary here, the method is not recommended under 16 years of age. In addition, the whole thing requires some lead time. So if cancer therapy must start as soon as possible, this method is not an option. The reason is that the patient first receives hormone injections for nearly 2 weeks, so that several eggs mature at once for retrieval rather than just one. Then the mature eggs are removed in a minor procedure under general anesthesia and frozen immediately afterward. This way they can be stored for many years, even decades. And if there is a desire to have children later and natural pregnancy is not possible, then the eggs can be thawed and fertilized in the lab. The fertilized egg is then placed into the uterus, and that is how pregnancy can occur. Now, let's move on to another possibility, which unlike cryopreservation doesn't require much lead time and can also be an option for girls before puberty. However, in some countries it is only covered by health insurance after the first period. We are talking about the freezing of ovarian tissue. During this procedure, either an entire ovary or just a part of it is removed in a minor surgery, minced and frozen along with the immature eggs it contains. And that only works if you can be absolutely certain that the ovary is free of cancer. If the ovary remaining in the body isn't too badly damaged by the chemo, it's usually enough to produce sex hormones. And that means that puberty can proceed quite normally. And later, in adulthood, the frozen tissue pieces can then be transplanted back into the fallopian tubes to restore fertility and also enable a natural pregnancy. In rare cases, artificial insemination is still required afterwards. But as I said, this is currently only recommended if the ovary is definitely cancer-free. Otherwise, there's a risk that cancer cells could re-enter the body during the reinsertion later on. That's why we're more cautious with this method for leukemias or lymphomas, because these types of cancers spread through the blood throughout the body, and could therefore also affect the ovaries. Okay, that was already a lot of information, right? But we've now almost reached the end. There's one more method, yes, but it's only used in very specific cases. Specifically, when the pelvic area is irradiated, namely the relocation of the ovaries during planned radiation. Relocation sounds unusual at first. Yes, but it's exactly what it sounds like. It means that the ovaries are moved to a different location within the abdominal cavity. They practically move, you see, so that they receive less radiation. This means there's a good chance they'll retain their function and still be able to produce hormones after radiation therapy, so the body can develop normally. But, and this is important to know, this method only protects against radiation, not against the effects of chemotherapy. In addition, the fallopian tubes often have to be separated from the uterus. The eggs can then no longer reach the uterus through the fallopian tubes, which means that a natural pregnancy is no longer possible later on. Technically speaking, the method is also possible for girls before puberty, but since it's a surgical procedure, it depends on the patient's situation, whether it's actually recommended. We hope this overview of all the methods to preserve fertility will help you a bit, for example, to start a conversation with the treatment team. Because as you've surely noticed, it's simply not possible to make a general statement, about which method is an option or most suitable. That's why it's important that you get good advice about what options are available in your case and what really fits your situation. And there's more than just medical advice, because it's naturally not easy at all, when you have to deal with such weighty questions as a young person, like wanting children later on. That's why the clinic's psychosocial team is also there for you and always has an open ear for everything that's on your mind. If you want to know more, you could also watch the video about the support of the psychosocial team. You can find out more there.